The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Blake with Leading Age Michigan. I hope everyone is having a great Tuesday so far. Um, Thank you again for joining us for another Safe and Calm webinar today. Obviously, we will have Omnicare as our presenters today, and we would like to say thank you to our valued business partner, Omnicare, a CVS health company, for being a part of this Safe and Calm webinar series. With Omnicare, you can expect customized expertise and benefits, superior medication availability, comprehensive infused therapy, advanced digital tools, and guidance through state and federal regulations to keep the community compliant, all while helping control costs. No matter the need, you can rely on them to deliver specialized quality services so you can devote your time to providing excellent care. If you do have any questions throughout the webinar, go ahead and type those in the question little tab right there, and we will address all those at the end. I believe that is everything that I needed to take care of. So now I'm going to turn the program over to Beth Courier, Senior Director of Strategic Accounts, to share more information about Omnicare and introduce today's presenter. Thank you.
Thank you so much, and good afternoon, everyone, and greatly appreciate your time today. And also definitely want to acknowledge and understand that this would be part of the annual conference this week in Michigan. So we wish that times were different and that we were all together at the conference together. But with that being said, we greatly appreciate the opportunity to be part of the Safe and Calm series that had been going on for a number of weeks. And we at Omnicare are sincerely honored to have this strong partnership with Leading Age of Michigan, as your preferred pharmacy to all of the members within Leading Age. We know that this partnership has been in place for a long period of time, and we are just so pleased with the partnership that we have and the opportunity to support both the annual conference as well as Leading Age's Leadership Academy. I would say, many of us have been in LTC for many, many years, and I would say that, we've weathered many storms from a regional perspective, but obviously this pandemic is new to all of us. And, obviously we continue to be agile to make sure that we're adapting during this COVID pandemic, but most importantly, ensuring that we're remaining steadfast in our commitment to service, not only all of you, but also for our shared residents. And so, with that being said, we are committed to continuing to be adapt, to be flexible, and really to rely on the strength of our enterprise and our incredible supply chain so that we can meet your needs as well as the needs of our shared residents. We've also made a lot of investments over the years in terms of our people, process, and technology. And now more than ever, we're leveraging those enhancements so that we can streamline our processes to help the nursing staff while being mindful, of our footprint and decreasing the footprint within your buildings. We are here regardless of COVID to also support your needs from a PDPM perspective. But we know at this time, our efforts are, as these series denote, to remain safe and calm and a really good partner to your staff and our shared patients. With that being said, we're thinking outside the box, and we've established a lot of virtual processes so that we could bring, not only the medications and have the medication access, but have our expertise through virtual technology. So we've been successful with even onboarding new buildings during the COVID timeframe by leveraging that virtual technology. So, for those of you that we don't have the privilege to service today, we look forward to definitely having that opportunity. We have 4 long-term care pharmacies within the state of Michigan, and we're available 24/7, 365, with a suite of clinical programs founded in cost containment, but most importantly, focusing on, medication access, and today more than ever, digital tools to aid your staff. So with that being said, again, we appreciate the time today. We're pleased to be here. From an OmniCare perspective, we again remain steadfast in med availability and streamlining process and really leveraging the CVS enterprise. And I'm sure many of you have seen that we are ramping up and looking to open up over 1,000 locations for testing in very short order. And one of the first to open is in Dearborn. So we're continuing to stay close in the Michigan communities, and we're also, leveraging our enterprise response and resiliency as well to be a good partner in the community. So again, we greatly appreciate your time today. Thank you for this opportunity. And it is my sincere pleasure to introduce the two presenters today. So Tom Katofias, who's our Senior Clinical Manager within OmniCare. And I would be remiss, Tom, if I didn't say go blue, right? I don't think you missed a game at the U of M. So, and I think Paulette Nigerian Knight is also on the phone today, and I don't think that Paulette ever misses a U of M game as well. And in addition, I'm pleased to also introduce Nancy Losbin, another colleague and our Senior Director of Clinical Services. So without further ado, thanks to Dave and everyone, and Blake and everyone at Leading Age. We greatly appreciate this opportunity. Thank you for all of you and your efforts to take care of, our shared residents on a daily basis. You are the heroes during this pandemic. We salute you, your efforts, and we are here to stand by you in support of the residents that we service. So Nancy and Tom, I'll turn it over to you.
Thank you very much, Beth, and I'd like to echo Beth's thoughts to all of you. My prayers go out to you and your staff as they courageously continue to care for the frail elderly during this pandemic season. Although currently the consultant pharmacists may be physically absent from your communities, we do continue to provide clinical services by way of remote MRR. During this pandemic, OmniCare consultant pharmacists have instituted a few new services to optimize drug therapy. These services include assisting COVID-positive communities in the review of nebulized medications to offer safe alternatives to reduce the spread of COVID disease, an acceleration of our deprescribing program, whereby we seek to consolidate and discontinue non-critical medications in order to reduce the MedPass burden for nursing staff and free up valuable nursing time, assisting in the assessment of thrombotic risk of COVID-positive residents to assure safe and effective use of anticoagulants for this population, and an immediate focused review of all new hydroxychloroquine orders to assure proper monitoring for potential side effects and various drug interactions. At OmniCare, we will continue to modify our clinical services to meet the medical needs of the frail elderly residents, and we look forward to our redeployment back into your communities as restrictions are eased. And with that, I'd like to introduce our main guest speaker for today. Nancy Losbin is a consultant pharmacist and Chief Quality Officer for OmniCare CVS Health. She was the chair of the American Society of Consultant Pharmacists Foundation twice during her membership for a total of 7 years. A certified consultant pharmacist, Ms. Losbin also holds certificates in gerontology, pharmacy regulations, and pharmacist liability. In November 2016, Nancy received the ASCP President's Award for her work on the Antibiotic Stewardship Think Tank and the completion of the ASCP Antimicrobial Stewardship Toolkit. In March 2011, Nancy received the Volunteers of the Year Award from the American Medical Directors Association. And in November 2010, Ms. Losbin received the ASCP Richard Berman Leadership Award for her dedication to the Society. Nancy represented the American Society of Consultant Pharmacists to the Long-Term Care Professional and Technical Advisory Committee of the Joint Commission for 5 years and was chair of ASCP's Educational Advisory Committee from 1999 to 2001. She was a member of the AMDA's Clinical Practice Guideline Committee for 4 years and has lectured pharmacy students at Temple University, the University of Sciences in Philadelphia, and the University of Maryland in Baltimore. And with that, I will now turn it over to Nancy Lazo.
Thank you, Tom. I appreciate that. And the words were very kind. Good afternoon, everyone, and thank you so much for taking the time from your schedule to spend it with us. We appreciate it. What I hope to do today is to help you review your current practices for pharmacy services and reevaluate your pandemic plan overall, as well as prepare for a second wave should that happen later in the year. With that, I think what we want to do is just take a look at what your best practices are in your building for pharmacy services, what your pharmacy services provider needs to evaluate for themselves to present to you to continue services, and what services do we really need to evaluate for delivering pharmaceutical care, especially for COVID positive residents and in facilities that have active cases of COVID-19. You know, for the chronically ill, medications are the mainstay of care in nursing homes. And in spite of the fact that COVID-19 has had the greatest impact on long-term care facilities and on elderly residents, you know, we're seeing today in our nursing facilities a lack of new admissions, brave staff that is trying to balance home life with coming into the facilities dedicated to our residents. We are seeing focused surveys from CMS that are evaluating our infectious control practices. And we're seeing that Michigan can potentially be one of the hot spots. And we have seen that around the Great Lakes, there is a high prevalence of COVID-19. Certainly not as high as we've seen in the East Coast, but certainly enough for us to realize just how quickly this spreads. And it's often said that one vector or one person can infect 5 people. And we call this a novel virus, but I'm not sure that the word novel is worthy enough for the virus that we're trying to relieve our residents of. And that is, the challenges presented with this disease are unlike any other influenza that we've ever seen. To see hyperactive autoimmune systems go into overdrive, to see DVT and thromboembolisms in our residents, to see a high level of drug-drug interactions, and many other events that are not associated with things like the common cold or even influenza is something that we have never seen before and we've never experienced before. So with that said, we may all have had what we thought were pandemic plans in place, but indeed this virus has presented to us the challenge of all challenges, because there's no pandemic plan, no matter how well thought out it was, that could possibly have supported this new novel coronavirus. So that is why this is such a different virus from any other. It has caused a myriad of secondary diseases that are challenging, the ferociousness of which our residents contracted it, that the shedding of the virus in what seemed to be asymptomatic, healthy people is how it got into nursing homes. And I will tell you, and I believe that when I read articles about long-term care, the prevalence of the disease, infection control practices from the newspaper, I become as upset as you do, because we realize that there was nothing like this before, and we were so unknowingly, unwittingly allowing people to early on come in to see their loved ones, to have employees and colleagues come in to care for loved ones without ever realizing that they could have given the virus to our frail elderly, and that people in their 70s and 80s would be those that would be most likely to have a negative outcome that we don't even know if it's permanent or not, let alone the rate of deaths that we're seeing in long-term care facilities. When we take a look at the statistics, and this was still only a few days ago, you're still sitting in an area that is still considered to be a hotspot, and the eyes will be on all of us. I live in New Jersey. Tom is in Michigan. We are both living your situation on a daily basis with you, and that is why it is so timely for us to be involved. We are serving across the country almost 2,000 nursing homes that have been affected by COVID. So our experience with this and what you need to do with a pandemic plan and pharmacy services is firsthand knowledge, although it is recent knowledge, and we're learning just as quickly as you are. When you take a look at the aspects of a global response to a pandemic, very much what we want to do is make sure that we are providing uninterrupted care to our residents. Let's face it, we all know that since pharmaceutical care is the mainstay of care in long-term care facilities, especially for the chronic care resident, and that who is left in our facilities today, that no matter what COVID brings to us, we have got to work through that together to be able to deliver the daily pharmaceutical care for diseases that are not associated with COVID, like heart disease, heart failure, high blood pressure, benign prostatic hypertrophy, arthritis, pain management, and hospice care. So while we are working through COVID, our eyes must still stay focused on the everyday needs and pharmaceutical care of the residents that are left in our buildings. When you evaluate what you need in your organization to create your stakeholders, many times we'll talk to nurses and clinicians, but right now we need human resources to help us keep our staff positive, keep them coming to work, finding new human resources to ensure that we can adequately staff our facilities. If you had any time yet to read the new CMS guidance on reopening nursing homes, one of those parameters or the guidelines under which we can open our facilities must be in the adequate number of staff to attend our residents. So without human resources, we're not going to get there. Emergency response resources, not only your EMTs and hospitals, but your supply chain management and your vendors there to agilely be able to respond to the needs of your facility. We may all have had some extra personal protective equipment on hand in the storage room as part of our pandemic plan, but quite frankly, no one realized how vicious this virus was and how much PPE we would surely need. In all of my days, I cannot remember either OSHA or the CDC telling us how we can extend and reuse PPE in the midst of an infection. Then you have nursing home operations and your administration to help things keep moving forward while the clinicians care for the residents at large and one another. And then, of course, you need your legal staff. Why do we need the legal staff? As if long-term care wasn't one of those areas where people loved to sue. We see already that there are lawsuits from families towards facilities where their loved ones died and they're out there claiming that it was either a lack of care, a lack of staff, or it was neglect. Those are all the resources you need to assure you have in your pandemic program and to make sure that your policies and procedures or the requirements of each of these individuals is what it needs to be. Outside of your facility, however, you really need to take a look at leading medical directors in your region. This is just like having an antibiogram. Everything about COVID virus and the way it reacts is really at the local and regional level. Taking a look at what your medical directors say, what your hospital's medical directors are putting forth, what the leading CDC medical directors are saying about the disease is important and needs to be incorporated into your program. Someone in your building needs to be dedicated to follow those. There's no way in the world you, I, Tom, or anyone who's receiving barrages of emails about what they're now learning about COVID, and it's something new every day, can keep up with it. Someone needs to be dedicated to monitor that information and get the pertinent information, the reliable information, the validated information out to the floors and to the clinicians. And of course, your infectious disease experts who you collaborate with in the hospitals and your laboratories is very important to include in your pandemic program. When you make your strong partnership with pharmacy, there's a couple of things that needs to be done at the onset. You probably have this in your pandemic plan, but communication is what we have found across the industry, whether it's long-term care, the laboratory, pharmacy services, emergency medical services. Communication is the one thing that is consistent and the one thing that is the easiest thing to miss. So select a point person at your pharmacy for communication. Make sure that your staff knows that this is the point person that they should call. Make sure you have that point person's cell phone number, that they're available 24/7 to you in an emergency. Likewise, you should be providing who we should at the pharmacy contact in your facility. Sometimes while the pharmacy shows up 2 or 3 times a day, seems to be reliable, you don't tend to think of calling them when you have an issue. Now, we want to know about every infection or every outbreak in your facility so that we can prepare to have medications on hand, infusion services on hand, whether we should know to come into your building or not. That point person making your communication tree and including pharmacy is critical. We also want to limit the pharmacy staff that accesses your building. In our first COVID positive facilities in Washington State, the first thing we did was limit the delivery of the medications to a single place within the nursing center so that our staff wouldn't wander through the building, realizing early on that COVID was brought into the building by non-caregivers or caregivers, your vendors, your visitors, or your caregivers, but the residents certainly didn't spread it among themselves. Screen your pharmacy representatives on the delivery staff per CDC guidelines if they're coming into your building. Again, consider a single location in your building to where pharmacy can deliver the medications. Make sure that after you sign for the delivery of your medications, even if it's an electronic device with an electronic pen, you wash your hands. But quite frankly, I would recommend that you not use the pen provided to you by a driver or someone in the delivery force. What you want to do is carry your own pen, nevertheless, washing your hands when you're done. Making sure also that if you have anything that goes back to the pharmacy, like your used infusion or enteral pumps, put them in a bag. Remember, the driver that comes to you may or may not be using a van or a vehicle that someone else will be using next. So what we want to do is put them in a bag so that they can be returned more safely to the pharmacy and that there isn't any contact with the virus when we take these very important machines back to the pharmacy for cleaning, disinfection, and recalibration. Also, evaluate what is in your infusion hydration emergency kit. You should have one for every day. You should have one for during a pandemic. And while we understood early on that there may be a patient that would have excess fluid and maybe delivering an IV would not be appropriate for hydration. However, when your residents don't eat for several days, when they're on a respirator, we know one thing, without hydration, they will have a more negative outcome than with. What is in there? What's your choice? How many? Do you put in your emergency kit? Where are the emergency kits located? In addition to that, the pharmacy operations also has its own issues that it's going to deal with. What's the infection control program inside a pharmacy? How are we in the pharmacy monitoring our pharmacy associates based on CDC guidelines? The last thing we want to do is be a vector for your facility. So we need to establish that consistent process, not only for emergency kits, but also if you have an automated dispensing unit such as a Pyxis or an Omnicell, how do they get replenished? Who replenishes the doses in there if the pharmacy usually does it? Do you want the vendor coming into your facility? Is the automated dispensing machine located in a part of the building that is not in resident care? Some of the other things to think about are suppose you had a cart that the lock broke, or it needed repair. What's the process that you would consider for having a pharmacy representative who may be asymptomatic of COVID come into your building and repair an essential piece of equipment? Our delivery procedures then for any pharmacy should be to reduce the risk of exposure through a centralized drop-off point with the coordination of the nursing teams. And that means calling ahead, letting the nurses know that the driver is on his way, and calling when they get there so that there can be a minimum amount of exchange and exposure between the pharmacy driver or representative and the facility staff. Establish clear processes for the return and tracking of infusion pumps. You want to make sure that, and we have seen this, that an infusion pump used on resident A is never used on resident B until it comes back to the pharmacy to be disinfected and recalibrated. We're trained on that. Your staff may not be trained on the cleaning and recalibration of infusion pumps. So to minimize the risk of infection from machines, even though they may not be critical vectors for the infection, they still have to be cleaned like any other device that's used repeatedly on an infected or non-infected patient. Make sure that you're ordering your refills in advance. If your pharmacy has an automated refill process, use it. If they have an anniversary fill process where they will go ahead and predict what needs to be filled, use it. Take advantage of the lack of prior authorizations to get medications out there quicker. Make sure that the physicians respond to calls from the pharmacy to get a medication covered so that we can deliver it as quickly as we possibly can. Remember, pharmacy is also cleaning and disinfecting itself with the CDC recommendations. Our staff is masked. They're using disinfectant. They're not having lunch in their rooms in the kitchen or their lunch rooms anymore. They're seated at their desks. They're cleaning their equipment, their laptops, and their computers very often to assure that we are not bringing any infection into your building. See if I can get this to go. So again, your human resources is establish a clear sense of purpose and alignment with all of your staff. Acknowledge the realities and the challenges that they have so that you can be confident and instill confidence in your staff that you are doing everything you can to calm the storm of COVID and allow them to feel comfortable and not only entering your building, but leaving your building when they go home to their family so that they can assure they're not bringing COVID with them. Manage the expectations of this up front, and that includes with your pharmacy. Things are going to be moving rapidly, they're dynamic in every way, and we have to be able to accommodate a shift in our direction at any moment, and that means coordination between the pharmacy and the facility. Take a look at a regular and open flow of information to limit the potential for your colleagues for maybe indecision or a lack of confidence. apply focus and energy at the task at hand. And while you may be even marketing yourself as a leader for the staff, it is imperative to your own staff and the staff of any of your vendors that you know what you're doing, your plan is working, you're openly communicating, and you are able to modify your processes as we learn more about this pandemic. Communicate any changes promptly to your teams, even the pharmacy, and let them know why you're changing something. You'll be seen as this leader that is acting promptly, but as you have said, in a safe, calm, unhurried manner. Have a contingency plan. If you have plan A, you might have to have plan B as well. Encourage your colleagues, recognizing their performance, acknowledging their teamwork, and use your resources wisely. Many times we see nurses who cannot leave and aides who cannot leave because they just don't have a replacement on the next shift. Maybe you're a facility that has moved to 12-hour shifts. Maybe you have the same staff come in at the same shift so that you don't cross over different groups of employees and staff members in your facilities. That's one of the things that pharmacy is doing. We're making sure that if we have people work on different days, that they consistently work on the same day so they can stay as a cohort together and not infect another team working on a different day in the pharmacy. And it's just something that human resources, again, really should be able to assist you with that. So what we want to do, again, is just to remember that you notify pharmacy as soon as you have a suspected or a positive case of COVID, that you remind us and yourselves of who the point person is with the pharmacy, verify that track of communication and telephone numbers, assure that you send your census to us every day so that we know who we should and should not send medications to. Collaborate with the pharmacy to identify the pharmacy staff who visited your facility. Perhaps they have been in your building and they need to do their tracking in terms of exposure to infection. We have been fortunate learning very early with the episodes in Washington and prevented drivers from coming into facilities almost immediately and protected our staff. But to be honest with you, we realized that that was a big ask of our customers to say, okay, we'll meet you at the door to accept your medications. But we also knew that we could not afford to bring COVID from the community into a nursing facility. So again, remember, if your driver, don't shake their hands, don't touch the driver, ask the driver to put your name in any proof of delivery device, just like you would with UPS. Don't sign anything if you don't have to. Freely give your name to the driver so that we can comply with pharmacy regulations. We must have proof that our medications were delivered, but we can do that safely without a wet signature or touching anyone to assure that we comply with the proof of delivery, especially for third parties. It's a mandate and we are audited on that. So you're audited on many things yourself and surveyed. We need to help you just as much as you have been helping the pharmacy. So again, ask the pharmacy to send a single and consistent driver to your pharmacy. Don't necessarily send medication, e-kits, or supplies back to the pharmacy. If you can hold them for a little longer until your facility is COVID-free. If you can't, double bag them, and then the driver will be able to handle them with his or her own PPE much easier in their own vehicle. Arrange to have the replenishment doses shipped to the facility and replaced by a nurse. We have some states that assure that a pharmacy representative replenishes or at least witnesses the replenishment of automated dispensing machines. And many states have given us waivers to have that done by video chat, where a consultant pharmacist watches this be done, or the pharmacy manager watches a nurse replace those medications into the Omnicell or the Pyxis machine. Ask your pharmacy to ship additional lots for e-kits if you're not going to be sending them back to the pharmacy. However, make sure that you do fax those e-kit slips to the pharmacy to ensure they capture new orders and that they screen for medication doses that are taken from the emergency kit. I will tell you that in the past week alone, pharmacists at our pharmacy reviewed thousands of severity 1 level drug-drug interactions. Many of those drug-drug interactions had to do with the prescriptions that are being used to treat COVID, whether they're approved by the FDA or not, causing us to make many, many telephone calls every day to assure and remind the prescriber about things like the QT interval that would be prolonged and the irreparable harm that can do in terms of causing a stroke or a heart attack. So it works both ways. We certainly upgraded our computer system immediately as we saw what was being used, captured as much of the marketplace as we could. We understood right away that nebulization could spread COVID more rapidly than the use of a metered dose inhaler. And our pharmacists have a list of medications, as Tom said, that are more convenient for your use, safer for your staff to use, that would minimize the spread of infection, especially with someone who already has a lung or other type of respiratory infection. Again, if a pharmacist is required to destroy controlled substances in your state, store them in a double lock security until the outbreak is declared over or it's deemed safe enough for a pharmacist or vendor to come into your facility to witness that destruction. So we've changed many things, and we have upgraded 13 of our own policies internally at Omnicare. We had to do that based on this new novel, unpredictable virus. The number of state and federal agencies involved, and some days we got direction to go north, while the next day we got directions to go south. So keeping on top of that information, having that point person as well collaborate with the pharmacy on the changes in direction and guidances will keep us all safe while we continue to, without fail, deliver pharmaceutical care to those long-term care, chronic care residents who need a myriad of their 15 usual medications every day, in spite of the fact that COVID is absolutely ravishing the nursing homes today. So with that, we are very, very happy to answer any of your questions, and that includes any of the newest guidance, drug questions, questions regarding opening up, or what you know about testing, or to share your best practice with everyone else on the call so that we can make sure that as a leading age organization, you get your value for membership, and that we trade this information to assure that we can render the highest quality service to those that we have the privilege to serve. Thank you.
All right. Thank you very much, Nancy. 1 second here. Let me go ahead and pull up the questions. All right. I am actually not seeing any questions right now. So I will give some people a few seconds in case they do have anything. They can go ahead and type them in. While that is going on, we would just like to say thank you again to both Linda, Tom, and I'm blanking on the other lady's name right now, and I feel bad. Beth, I believe. Sorry about that. Want to say thank you to all of them and Omnicare for joining us today, presenting. We would also like to thank, I believe we are up to about 30 members and participants that took time out of their busy schedules to join us for today's webinars. We appreciate everything that you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. Just a reminder that we will have our Housing Matters program coming up on May 28th. If you would like to to sign up for that. You can find that in the events section on leadingagemi.org. We also have another COVID-19 webinar with Deanna Mitchell this Friday at 11 a.m. So feel free to join that. If you don't have the link, you can feel free to reach out to me, Blake, B-L-A-K-E, at leadingagemi.org, and I can shoot you that link over. Or you can go ahead and email info@leadingagemi, and more of us will see that. I actually did have one question come in. So it is, what are the most common drug names associated with interactions that you are seeing?
Well, thanks for that. And what we're seeing is primarily the hydroxychloroquine and the azithromycin that was used early on. But we're also seeing an array of medications that interact with hydroxychloroquine that also prolong the QT interval. Some of them are well-known antibiotics. Others are other cardiovascular drugs. Tom, what have you seen out there for these drug-drug interactions?
Yeah, let me concur with the azithromycin, especially early on, based on that French study. A lot of prescribers were going to azithromycin along with hydroxychloroquine. Unfortunately, both of those drugs can prolong QT, and so prescribing them together, you really better be monitoring those closely. And I know a lot of hospitals, at least here in Michigan, have dropped that azithromycin from that protocol simply because of that severe QT prolongation when it's being used with the hydroxychloroquine.
So, one of the things that we see too is there were many facilities out there who didn't have telemetry, they didn't have EKG machines, and they were not able to appropriately monitor the QT interval. So perhaps when you come to your next pandemic program planning and your budget, these are some of the things that you might think about if you have or you realize that there was something that you lacked. Maybe it was something that would make life easier for you, a more electronic blood glucose machines, just so the nurse's time would move along quicker and you could divert to nursing care rather than testing. These are the types of things that you might want to think about in your next iteration of your pandemic program. Just don't think about PPE, but what did you wish you had that would speed things up for nurses, make it easier, even for dietary, for example, down in the kitchen to get the trays up with less of a hassle, the ease of transitioning over from, paper to paper cups and dishes and disposable forks and spoons. What makes that all easier up on the floors, down in the kitchen? I have had the luxury of working in long-term care buildings for a long time in the nursing home administrators training. And believe me, I know that there are many things that we all wish we had, and this is the time to ask for it.
All right. I do have one more question. Just to clarify, should an IV pump be sent back for cleaning with our pharmacy provider, or should we be holding the pump until after the disaster is declared over?
It depends on your pharmacy provider and what their infection control program is. Right now, our pharmacy is having you send them back because we only have a limited number of IV pumps, and eventually someone would be missing one. So if you double bag it, then the driver can use gloves, put it into another plastic bag and put it in their car. Here's the reality of things. Many couriers who deliver drugs in this industry, regardless of what pharmacy they use, are using their own personal car. And what we don't want to do is send back contaminated machines or drugs with the driver so that it becomes contaminated when he puts his children in them to take them out to a park for the day. So these are the types of things that we're thinking about, and we're so appreciative of the nursing facilities staff cooperation with these infection control programs. I will tell you that the nursing staff has just been remarkable in every way for just about every vendor that they have.
All right, and it looks like that was the last question. So thank you very much again to Omnicare, Nancy, Tom, and Beth. Everyone have a great day and stay safe. Thank you.
Thank you.